Let's speak with Tony O'Sullivan, co-chair of Keep Our NHS Public, also a retired NHS consultant paediatrician. Tony, good afternoon to you, sir.
Hello, Ian. Hi.
Do you not feel rather glad you're retired now with all of this going on?
Well, I felt relieved to be retired throughout the pandemic, where I saw amazing colleagues suffering at the front line and giving their lives for the NHS. But it's certainly a terrible crisis, very, very serious. And yes, I am, but I'm here as part of Keep Our NHS Public, trying to maintain the call for the NHS to be supported.
And it appears, well, according to this report from MPs, that one of the problems they're up against is that people come up with a lot of ideas, but they're met with this sort of impervious wall where you can't break through. People are not susceptible to change, I suppose, is one way to put it. What is your response to that?
Well, in a way, I'm not here to defend the Department of Health or NHS officials, but I would say that I was at my local health board for the Integrated Care Board in my part of the world last week, because it was their public consultation on the government's very proposals that we're talking about here. And in their own introduction, they warned us that the Integrated Care Boards around the country are facing an £8 billion deficit this year. And they are warning that they are facing cuts in services rather than repairing what's going on. They were warning that, and they were saying that they face about 1,000 job losses within the Integrated Care Board part of the NHS. And they were talking about the 14,000 avoidable deaths in the last year because of delays in the urgent care pathway. Yeah. And I would add, 107,000 vacancies, 32,000 vacant nursing posts, huge numbers of unemployed doctors, even though we desperately need more GPs and we desperately need more anaesthetists, and the large numbers of community nurses that are needed. But the workforce planning in the last decade has completely failed to produce them, so that they're just not available. And of course, there are separate crises across the system: maternity care, mental health, and dentistry. So, I'm as an ex-paediatrician, I feel that the NHS is really suffering and needs political support from the government and funding.
One might think, understandably, that this is a Labour government, that they would be, they will always argue. I mean, there's a little bit of a debate on, how the NHS came around and sort of multi-party support mostly back then in the 40s. But, they would say, look, we are the party of the NHS. Wes Streeting is a man very passionate. He's had to, as I'm sure you're aware, previously use the NHS for very serious procedure recently as well. So, it's in their DNA to support this stuff. They want it to succeed. But many clinicians and people like yourself are clearly not seeing enough evidence that the changes required are about to happen.
Well, no, you're right to point that contradiction out. I mean, I would say as an ex-paediatrician, but also even as a human being, the fact that there's the equivalent of 40 jumbo jets crashing and killing 14,000 people in a year, that for me is an emergency, and that should be the immediate focus of the government. Now, in some ways I don't disagree with the three tranches of their plan to have better community-based care, to reduce the illness in the first place, and indeed IT transformation. But if a building is burning down, you don't decide, let's restructure the staff and install new equipment. You actually deal with the fire, and the fire that I'm talking about is the desperate frontline shortage of funding, shortage of staff, not enough beds, the crisis in social care, hospital ceilings falling down, operating theatres closed because of that, loss of capacity, and the government's decision to spend £2.5 billion in extending the private sector's capacity to deal with NHS patients for elective waits is missing the real crisis of people dying immediately here and now from delays in ambulance care, delays in transfer to hospital, delays into the A&E, delays in getting a hospital bed, and then huge pressures on social care, which means that people that need to be looked after properly with dignity in the community are still staying in hospital.
How are other countries doing it better, or why are they doing it? You know, similar-sized economies, you look at France or Germany, Spain perhaps, who, and I don't mean this as a point about, you know, Keep Our NHS Public or whatever. They are all services, which, as you'll be more aware than me, that are free from cradle to grave. They have slightly different ways of doing the insurance-based policies, ownership of hospitals in the private sector in Germany and things like that. But it's broad, it's free, basically. Better outcomes. What are they doing that we're not doing? And shouldn't we just say, well, let's do that?
Well, I mean, the standard of care, for example, in France, I think at the moment is very good. But if we just cast our minds back a few years to 2010, that was a period where the NHS had been funded to catch up almost to the equivalent of France and Germany in terms of capital, in terms of spending per person. And at that point, and right up to 2015, when, you know, after 5 years of austerity, the wheels were beginning to come off. But for all that period, the NHS was judged to be the best overall universally accessible, comprehensive health service for a major country in the world. For the 11 nations that this periodic review was from the Commonwealth Fund in America. And I think we need to know that when the NHS is funded to successfully deliver for the patients and for the population, it is actually more cost effective than France and Germany. I'm not asking for the £40 billion shortfall that France gets over Britain or 70 billion of Germany, but I do feel that lack of investment over the years is the reason why our hospitals are crumbling. And we don't have enough scanners, we don't have enough MRI scanners, we don't have enough CT scanners, the 107,000 vacancies. Part of that vacancy factor is that trusts are being told to hold back on spending in order to try to bridge this £8 billion gap within year. And although the government invested 25 billion at the last autumn statement on the 30th of October, that really was only allowing the NHS to tread water, given the huge amount of underfunding and undersupport that had gone on previously. So although it sounds like a lot of money, caught up with the deficit compared to other comparable nations, I think it's the Health Foundation argues that to actually start rebuilding the NHS, we need about £38 billion a year for the next 5 years. But I would also say that every pound of public money that's invested in healthcare at the moment should be invested in rebuilding the NHS back to capacity. And where the NHS has been funded to succeed, it has not relied on the private sector. It has delivered amongst the best health outcomes in the world.
Somebody here just sent us this message, Tony. He says, regarding the NHS, according to NHS Digital, there are more doctors and nurses now than before Brexit. With more funding, it's the world's 7th biggest employer in a country, only 21st largest in size. How much more cash and staff do these people propose the NHS needs?
Well, I would say that we simply cannot afford not to have a functioning NHS. We've got nearly 3 million people out of work for health-related reasons, and that's gone up nearly 1 million since the COVID pandemic. It's all very well to say that the NHS has more money than it needs. It simply does not. And anybody that thinks that it's slacking staff that is the reason for 14,000 people dying a year, or for the waiting list being 7.5 million, they are really being disingenuous, and they are not being fair to the NHS, they're not being fair to its staff, and they're not being fair to the patients who need a functioning, excellent NHS again. So I think that when the NHS has been funded so that it can function very well and have minimal waiting lists, as was the case in 2010, then in comparison with other major economies, we get value for money. We get the best value for money, and that is why we feel you cannot afford not to invest in the NHS, and that, for me, is part of the country, its economic recovery as well as perhaps its moral recovery.
Okay, Tony, it's very thorough stuff. We will speak again, I'm sure. Thank you, Tony O'Sullivan. He's the co-chair of Keep Our NHS Public, also former NHS consultant, paediatrician. Thank you to him.